Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Harvey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and today, Friday, on the Harvey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 20th of May. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, who's a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great.
Now, in the United States, we are seeing a huge rise in cases. Yesterday, we saw 112,559 new cases with a 7-day average now peaking over 100,000 positive cases with a 59% increase over the last 14 days. Hospitalizations are up, increasing by 31%. And in Illinois itself, yesterday we saw 7,000 positive new cases with a 7-day average of nearly 6,000 positive new cases with a 52% increase in overall cases over the last 14 days. Hospitalizations are also increasing exponentially in Illinois with a 41% increase. What can you tell us about what is going on with this massive COVID surge? And are the numbers actually accurate?
The numbers aren't accurate at all. They're much, much worse because the people that are getting diagnosed with a home test kit are not getting counted. So take these numbers and multiply by whatever your favorite number is, 2, 4, 6, 8, 10, and that's the real number. But what we do know, although we don't know how many cases there are, except that there's more, the hospitalizations we do know, and the death rate we do know. Now, deaths take weeks to kind of get into this equation, but we're there. The death rate is pretty flat, going down in some places. The hospitalization rate, though, has increased, so maybe that will change as well. But we're nowhere near where we were on the hospitalization side as we were in January with the huge Omicron wave. Okay, so what do we have? Number of hospitalizations, they average somewhere around 25,000 in the United States. Remember back in the Omicron days, it was 160,000.
Yeah.
So there's a really, really big difference. And in Cook County, here in the Chicago area, we're at a medium risk for cases rate, and that's defined as having 200 cases per 100,000 population, and they're already up to 338. Another thing they look at here is the number of hospitalizations per 100,000 people per week, and 10 is considered like high, and they're at 8, so it's gone up. But if you look at the number of ICU beds in use, 10% is considered high risk, and they're only at 2.5%. So I think what's happening is that we are getting protection from severe disease because of the people that are vaccinated, but we're also, I think, we're starting to see the influence of Paxlovid, the oral treatment, which is getting more and more widespread. It doesn't matter whether you're vaccinated or not vaccinated, it does protect you from ending up in the hospital. So I think all that put together is why we have the hospitalization, the death rate still so low.
Yeah, absolutely. And this goes right into our first headline talking about surge in cases. North Korea's COVID outbreak continues to spread. What can you tell us about this country that has no vaccinations and a huge COVID surge right now?
Yeah, well, they're in a lot of trouble because they have no immunity from prior infection. They're not vaccinated. They don't have access to Paxlovid. So they've got everything going against them. And what's happening is, I mean, when we were infected, the United States and Western Europe, the rest of the world, we had a pretty benign variant. Our type of COVID at the beginning wasn't as bad, did not transmit nearly as fast as Omicron does. And so they're getting hit for the first time with a really, really infectious COVID. You're going to see it just rip through that country. I mean, it's really going to be a crisis there.
Yeah, absolutely. And now going into our second headline, here in the United States, as COVID cases are rising, officials plead for more funding. What can you tell us about how much it costs for Paxlovid to be distributed, et cetera?
Well, I mean, the pandemic hasn't gone away. If we want to live with this thing, which is the goal now, you've got to keep people vaccinated, keep them boosted, work on a second generation vaccine, and get the Paxlovid and other oral therapies out there where they can do some good. Make sure people can make the diagnosis. So, the White House recently just approved another tranche of home test kits. If people want, they can ask for them to be sent to them for free. We've got to keep that up. If we stop doing that, I mean, basically, we're going to be in a huge amount of trouble, much more trouble than we are right now. This is not a time to give up on a pandemic.
Yeah, absolutely. And now going into our first COVID question. This individual says, my son tested positive last week, Tuesday. His sons 4 and 2 weren't tested, but had symptoms. They all tested positive last night, Monday, so a couple days later. If they don't have symptoms, how long do they need to be isolated? We babysit and we're wondering, when can we be with them? We're 65 and 69 and are both fully vaccinated.
Well, there's a couple of things going on with the story. So the good news is that the grandparents are fully vaccinated. The bad thing is that it's a highly infectious variant that's out there. The kids, if they don't have any symptoms after 5 days, they're supposedly have less of a chance of spreading COVID. And, if they can wear a mask, I don't know if the 2-year-old can do it, but if they can wear masks and the grandparents can wear masks, that would be the safest. But if you really want to be safe, or if they have some underlying diseases, they should wait for the full 10 days before they get back in dealing with those kids.
Yeah, and this goes right into our second question that I think has confused a lot of people. Dr. Murphy, how long should people be isolating if they test positive, if they have symptoms? Can you explain for us a little bit?
Yeah, so we don't really have a good test to determine who's infectious and who's not. Obviously, if you're doing one of those home tests and it's positive, you're pretty infectious. All right, but we don't know when that turns negative how infectious you really are. So the kind of rule of thumb, without doing really fancy tests, which aren't available anyway, is 10 days. People pretty much are not infectious after 10 days, assuming that they feel better, their fever is down, and they're on the mend. However, so many people were out for 10 days that, companies were having trouble, keeping things going. And some people had very few symptoms after 1 or 2 days. And so a compromise was made so that the official isolation that's recommended by CDC is 5 days, considering that the first day you develop symptoms or your test is positive is actually day 0. So then you count from there. So at 5 days, you have to be isolated, and then you can go back to interacting with people as necessary. So, just not freewheeling, wearing a mask, a good mask, and for another 5 days. So that 10 days total, but the last 5 that you're interacting is with the mask. And that's why the recommendation for those grandparents would be, after the 5 days, if the kids are wearing a mask and they're wearing a mask, it's okay. So it really depends how they're feeling. Now, what didn't go into that recommendation was doing these tests. Like, what differences does it make? What difference does it make if the test is positive, the rapid test is positive, or if it's negative? We know the PCR test can be positive for many weeks, and that does not mean you're infectious. But the antigen tests are different. They correlate with infectiousness much better. So if your antigen test has turned negative and you feel well after 5 days, you're probably not as infectious as other people. So it is confusing, but I think the guidelines are pretty clear. 5 days isolation. Remember, the first symptoms are actually day 0. So people oftentimes don't count the way the CDC is counting. And then the second 5, be careful. If you have clinically improved, you can interact with other people, but with a good mask, and the other people also wearing a mask.
Wonderful.
So it makes it pretty simple.
Yeah, that's very clear. Thanks, Dr. Murphy. And now for our third question. This individual says, I am double vaxxed, double boosted, and still got what I assume to be the BA.2 variant of COVID last week. I would consider my symptoms to be slightly moderate. I was able to get Paxlovid that seemed to help with severity. Other than me, this individual, being age 50, I am otherwise very healthy. Can I assume that I have decent immunity at this point, or that instead I'm one of those folks who needs to worry about getting COVID again anytime
No,
soon?
this person does, I mean, this is a good question because this person doesn't have to worry about their immunity. This thing is so contagious and the vaccines don't help in terms of getting infected now. They'll just prevent you from getting serious disease. And on top of everything else, this person took Paxlovid. So that helps even more. That's why they had sort of a mild thing. And this is the kind of case that we're going to have to live with. And this doesn't mean that this person is immunocompromised. This is just bad luck out there with a very contagious disease. But this person did all the right things, and that's why they're not going to get too sick.
Yeah, absolutely. Well, those were all of our COVID questions for today. Thank you, Dr. Murphy.
All right. We'll see you next week.